Welcome to Not Milk Never Milk. Subscribe if you're lactose intolerant.
You start by stabilizing symptoms and creating a controlled environment. First, quickly check swelling and pain patterns so you know what to avoid. Then begin targeted quadriceps activation, 2-3 sets of straight leg raises and isometric quads to restore neuromuscular control. Once done, cut high-load activities, no deep squats or hard runs, reduce activity by about 50% for several days. This reduces patellar irritation and lets you build gentle control, which is essential before progressing to strengthening. Now you move into structured progressive loading to correct tracking mechanics. Emphasize the vastus medialis, oblique and lateral hip muscles. Do short arc knee extensions, clamshells, and banded side steps 3 times weekly. The why? Stronger medial quads and hip abductors counter lateral pull on the patella. Once you can perform 3 sets of 10-15 reps with good form and pain under 3 out of 10, add controlled functional loading in the 0 to 30 degree range and gradually increase range as tracking improves. To finish, you follow a measured return to sport and long-term maintenance plan. Slowly increase training load about 10% per week, always prioritizing alignment and movement quality. Integrate eccentric quad work and hip strengthening into maintenance sessions. Keep mobility routines and soft tissue work to prevent recurrence. If you still have audible catching, unstable giving way, or pain above 4 out of 10 despite consistent progress, stop escalation and seek reassessment. Imaging or orthopedics may be needed to address structural or biomechanical issues.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.